Happy New Year, everybody. We're starting a new series on this channel to talk about the importance of interdisciplinary, multidisciplinary care when you're dealing with complex chronic illness. And I have the pleasure of having Dr. Valerie Rogers with me today. So if you are just patient with us for a moment, I will add her to this. We are It's a learning experience. Yay! It worked.
Yay! Hey, how are you?
I'm good. How are you doing, Valerie?
I'm good. Thanks for having me here.
Thank you for joining me, and thanks for your patience. We're both new to Instagram Live, so I know we're probably late, very late on the trend. But thanks for taking a few minutes out of your day to chat with me.
Oh, I'm excited to. Absolutely, no problem.
Well, I wanted to do a little introduction and then give you space to tell us more about yourself. Dr. Valerie Rogers earned her degree at Drexel University in Philadelphia, Pennsylvania, and serves as both a physical therapist at Strive PT and as a hypermobility program director at Mount Sinai. So I'm so thrilled to have you. You are an expert not only in EDS and chronic illness as a patient, but also as a medical provider. And we got the opportunity to meet at the EDS conference this year. So I'm really, really happy to have your expertise.
Oh, well, thank you so much, Kelsey. I'm so excited to be here. It was an honor to get to meet you in person at the conference, and now to continue sharing our expertise together online here is really exciting. So yeah, like you said, I've been with Strive Physical Therapy for a few years, and I treated there as a physical therapist, and I started to grow the special interest program. We were focusing on treating patients with connective tissue disorders, which mostly wound up being hypermobile Ehlers-Danlos syndrome. And then through that, we became very comfortable with treating POTS as well, and we even started developing a POTS protocol, which has been really exciting. But then actually for the same reason that I got into physical therapy, I had to take a little bit of a step away, just as a little bit of a break from the in-person side of things. You know, like you said, I wanted to be the provider I couldn't find as a patient for these things too. And so I had some neurologic manifestations come to be, and as those continued to develop, I took a step away, had to get a fusion and, you know, all the neurologic management. And that's how I landed in the position at Mount Sinai, which has been an incredible dream as well. So I reached out to one of the referring providers over there and just said, hey, just so you know, I'm not gonna be able to take some of your patients. This is what's been going on with me. And, you know, he was very kind and said all the right things. But what he also said was, are you interested in education and research? And yes, I've always been, and my passion is to make sure there's more providers, not just in my area, but everywhere, of people who can help others with connective tissue disorders, you know? So I was really
Absolutely.
excited by that. You know, after I recovered a little bit from the surgery, this was a remote position, and now I'm able to conduct my own research and find the best practices for these patients, and I'm able to go educate other providers on how to treat this. So we're really expanding the world of EDS treatment and hypermobility treatment. I'm really excited and passionate about it. So I'm so grateful for the opportunities I've had.
I mean, it's just amazing because when I hear you talk, which I've had the opportunity to a few times, it's just so clear your passion, not only as a patient advocate, but as a provider. And do you feel that you are helping educate the next generation of doctors and PTs and other medical providers with all of this? Because that certainly feels like it when you describe it.
Oh, well, thank you. That's definitely the goal is in everything I do. I always want to make sure I'm leaving a little bit of a paper trail and then, you know, teaching the next generation how to do this. And I feel like I'm in that generation. You know, I haven't really had years and years of experience, but I jumped right in with the connective tissue disorder population, and having the advantage of knowing what's worked for me in my own attempts to do my own rehab
Yeah.
has really given me a neat edge as to what creative angles can we take so that we can keep progressing this treatment. I think it's really important to actually not only educate, but then back these things that we're educating with research too. So that's why it's something I'm really passionate about. Thanks for recognizing that.
Yeah, of course. And, you know, it's a multidisciplinary care is kind of why I wanted to start doing these interviews, because I have the mindset that it takes a team to find stability. And it's not just mental health, it's not just physical health. We need all of these providers. And you have the amazing lens as a patient, and I hope I bring that as well to my work. Of I'm never going to ask you to do something that I wouldn't try or I don't want to do. Like you're putting all of this research behind that, which is really important to have the data so that other people can start replicating this too. But I don't know, you come into it also with more of a trauma informed and personal approach, and maybe what people will buy into.
Yeah, and I really love the way you put that. You said it takes a team to find stability, and a little bit of a pun, but a little bit serious, right? Like it takes a team to find the stability in the joints that we really lack, but also the stability of it's just so hard to manage all of these things. And that's something that I say whenever people come in for an evaluation with me, or whenever they're feeling like they're losing hope with physical therapy or whatever management strategy they're using, is have the grace with yourself that by showing up and by continuing to try to manage this, you are doing so much for yourself, and that's not easy. And I think that's somewhere that you and I really bonded right off the bat, is that you and I have that similar trauma-informed approach, and you're such a comfortable clinician to talk to that I'm sure it provides such comfort for so many people, because they've been invalidated time after time again. And I know that that's not part of the physical health, but your mental health directly impacts the physical part. And so that's one of many, many ways that it's interdisciplinary.
Absolutely. And you actually guided to the next idea I had naturally. It's that there are ill-informed medical providers, right, that will insinuate that, like, I've done all I can for you. This is in your head. Here's a therapist. And so how do you find like you can help people recognize that that's not what I'm saying? I'm saying, I believe you, your pain is real. And this is another layer that can be really helpful. And obviously that's, you're coming into it with a I believe you first mentality too, right? So that's its whole other thing, but it can cause a lot of medical trauma that you were talking about. So for you, as someone who is informed and would not take that uninformed approach, how do you share with clients why mental health support is a good idea and that it's not stigmatizing for them?
Oh my gosh. Because 9 times out of 10, when you do these evaluations, they'll agree that they have exactly the experience that we're talking about. And I'm in a great position as a physical therapist where I get to show them, hey, here's this test, here's this abnormality. I'm not saying this to show you all that's wrong with you. I'm showing you this to validate you. Look what you're living with. This is so hard to battle. This isn't normal. So therefore, it's not in your head. And so, a lot of providers have this stigmatized way that they don't want to come to the patient and say this and this and this and this is wrong with you, because it's fear mongering. Right. And you have to find the right balance between creating an issue of fearing what your body's doing, but also you need to be honest with your patient. These patients typically know and understand a lot about their body. They know their body best. They've been invalidated of that time and time again. So showing them this isn't normal. This is what it should be. This is what yours is. So this is proof for yourself that you're not making this up.
Yeah.
And the fact that you've been told that has damaged, this thought process and that process. And I'll even take some examples of things they've said to me and challenge it back. If they tell me I can't do this because somebody told me XYZ, and then I watch them be able to do something similar, I'll cite that. And I'll say, and that's where, it matters how you talk to yourself. Yeah. And then I refer to somebody like you.
Right. No, and I love that's so beautiful how you phrase that of I'm listing all of these things and showing all of these things to validate. This is incredibly hard to live with. Like, and that in and of itself, I think could be such a healing moment for people in your office or on your telehealth screen to be able to say, well, okay, well, she gets it. And it is really hard. They're waking up, every day with this invisible condition that, no one else can, not many people might understand or see truly what they're going through.
Yeah, well, and you said waking up with the pain, and of course that's true and literal, but again, to take that in another route, it's almost like when I get to do these evaluations and I show the patients, hey, this is real, it's not in your head, I'm finding these things, it is objective. It's almost like a moment of them waking up, of realizing that, hey, oh my gosh, I didn't do this to myself. And I can
Yeah.
speak to this from the provider point of view, as I've seen so many people come to this realization, but
Hmm.
also from a patient point of view, I've been there.
Hmm.
And that's another point that I'm
Hmm.
very open with my patients. And I'll tell them,
Yeah.
hey, I've been in your shoes. I have thought to myself, am I doing this to myself? Am I manifesting this somehow?
Hmm.
And I think having these people talk to each other, talk to me, talk to others with the same experience is also really eye-opening and can really wake them up, if you will, to help
Yeah.
understand that what they're going through is, it's individualized, but they're not alone.
They're not alone. And you also highlighted like how they talk to themselves is important, right? That feedback loop is so important. And naturally, you gain a lot of fear if you do things that cause pain, you avoid them, right? So that's where, therapy and CBT and third wave approaches can be really helpful to challenge that. And I'm curious, like with your multidisciplinary care approach with clients, I know I tend to refer a lot to PTs. Oh, yeah, I mean, I would say that's my top referral always. Sometimes like nutritionists, sometimes surgeon referrals that I know of, that I don't know if it's the right thing for you, but here's people I know in the area. Do you find like a certain team that you kind of like to help assemble for your clients?
I do, especially I'm lucky because I'm treating in an area that has some people that know what they're talking about. And I know that
Yeah.
that's not everyone's privilege to be able to say that.
Hmm.
But also, if you
Hmm.
can find one provider that knows what they're talking about, really latching on to them and letting them help you so that they can help train some other providers. I live
Yeah.
near a cardiologist that's very knowledgeable about POTS, and I'm very lucky for that. And I refer almost everybody over to her. And everyone's very grateful to find her. But then there's other people, like there's a neurologist, we didn't have one in the area. And
Hmm.
so once I heard she took a patient or two with EDS, I latched on, and so I kept referring
Yes.
over there. I kept providing her with the education that she needed. And so I think building that team and as a provider, not being afraid to give that education, sometimes that's a weird place. You don't want to feel like you're
Hmm.
coming off like, I know more than you, but
Right.
sharing the knowledge and not gatekeeping, that way people have access to the care is so important. But I agree, I'm
Yeah.
always referring to mental health therapy.
Right.
Cardiology is another big one for me.
Yeah.
And then same thing, looking for somebody. There's a lot of people who need some of these surgeons that are few and far between as well.
Right. I mean, it's such I think a gift when you do find a medical provider that's open to the knowledge. And I mean, I'm very lucky to have people like you in my referral network and other people that over the years are so willing to learn, ask questions. They want to do more in this area. And that willingness is not a sign that they don't know what they're doing. It's a sign of strength, right?
Oh,
Yeah.
absolutely. It's even like what you've been told years and years ago and not related to EDS is like if you ask a teacher and they don't know the answer, it's better for them to say, I don't know, than to make something up. It's
Yeah.
the same thing when you try and refer to an interdisciplinary care provider.
Yeah.
If they tell you they don't know and they're asking you, that's a good provider. They want to know. And so I get
Yeah.
really excited when I find somebody like that. And so then I
Oh,
keep referring there. But it's also really important for patients to be organized as they're getting all of these referrals. And it's so hard to keep track of it. I mean, I know for me, it goes through phases. At one point, I'll feel like taking care of myself is a full-time job. Then other times,
yeah.
I'm all right. I'm keeping up. But
Yeah.
all in all, making sure you follow through on these referrals and have the organization to know where is next and what do you need to bring is all really important. And
Hmm.
Kelsey, I remember we were talking about a place people can stay organized. I know this is, I'm not an ad. This is just
Yes.
something I'm
Yeah.
really passionate about. uh, but there's an app and it's called My ID, and they
Oh,
generate a little QR code so that it brings, if you need it on like your lock screen, you can put it there or on jewelry so that it brings you to your medical profile, but allows you to put in like all of your different providers, all of your different medicine, the different dosages. So that way it's all in one place when somebody asks, or if you need it.
yeah.
I, as a patient, rely pretty heavily on that one.
Yeah. I mean, that is so smart. And also, I'm thinking mentally of the mental load that takes off of you. Maybe you're filling out paperwork and you can say, see my ID instead of having to go through all that, because that can also elicit some trauma having to go to a new provider, right?
My
That is just all of that takes off a lot of mental stress.
Oh, yeah, for sure. I mean, I know one of the providers I have in mind that I go see myself. Every time you go, they ask you for all the providers, all of their phone numbers, all of their faxes. Like, I don't know this off the top of my
No,
head. Does anybody? So it is nice to have
no.
it in one place.
That's a great plug. My ID. We're not paid promoters. We're just that's a wonderful tool. And I think as we're wrapping up, I feel like the theme of hopefully of this series is that, chronic illness is a medical trauma. It's an ongoing medical traumatic experience, and we need all disciplines to find stability, right? And the idea of something being chronic, there is not a cure with when you're dealing with something with chronic. Well, I say I'm not the medical professional here, but broadly speaking, if something
No,
is
you're
chronic,
right.
we know it's an ongoing problem, right? So I think it's important to talk about like why this is a big deal to have some mental health and physical health components together, because this is something for life. It's a tool for life. And if we can get you to a stable place faster, we get you to living your life more freely again, right?
Oh my gosh, absolutely agree. And this is more your territory than mine, but something that I always say to my patients is I want them to remember to be like proud of themselves, because
Mm-hmm.
everything that you do with their chronic illness is that much harder. And one of the examples that I give to some of my patients is, if you have 4 out of 10 to give today and you give a 4 out of 10, you're giving 100%. And
Mm-hmm.
people don't always give 100%. And here people with chronic illness are usually giving 100%, even if it's not a 10 out of 10. And so
Yes.
I think it's just really important to balance back and forth, and the balance between the physical, the mental health, and all the other disciplines that come into play as well.
Yeah. Oh, that's such a beautiful note to end on, I think. Just reminding yourself to be proud of yourself. I absolutely love that. Thank you. Thank you so much for being my first guest
Oh,
on this series. And thank you for everything that you're doing for the hypermobile population and beyond.
oh, well, thank you for all that you do. And I'm so excited to connect with you and for us to continue to connect with each other and each other's patients and
Yes.
everything that goes beyond. So thank you again.
And if anybody wants to follow you, your Instagram is Bindi Body Blog,
Yes,
correct?
that is
Yes.
correct. Got it.
Awesome. So people can find more info about all the fun things and interesting hats that you're wearing and get to follow along.
Oh, well, thank you so much,
So
Kelsey. It's been great talking to you today.
thank you. You too, Valerie. Take care.
You too.
Bye.
Bye.